communication. Our cells like to communicate, they like to talk to each other, they like to send a message or a signal from one cell to another, so every cell knows what's going on and what they're supposed to be doing. And our cell use two methods to communicate with each other. They use local signaling and long distance signaling. With local signaling, our cells have to make direct contact with each other. I like to think of it as a bro shake, so like, take my hand. Oh, he got the message, I touched him, everything's great, he knows what he's supposed to be doing. With long distance signaling, the cells don't have to touch each other directly. The signal travels through a short distance, so I like to think that it just jumps from one cell to another. It's like a wave. He got the message, didn't have to touch him though. And the signal they're passing transports through a process called the signal transduction pathway, but we'll get more into that later. So we'll start with hyperimmunoglobulin M syndrome, which I'm sure most of you haven't heard of, didn't know how to pronounce it. I didn't even know how to spell it until about Thanksgiving. But we're going strong. And hyper-IgM syndrome is an immune disorder, and it's characterized, the patients have an elevated, or they can have normal levels of the antibody class immunoglobulin M and immunoglobulin D. And these antibodies are the first antibodies that our body produces, and they are our first line of defense against pathogens or things coming into our body that can make us sick. And there are 5 different types of hyper-IgM syndrome. There's X-linked, type 2, type 3, type 4, and type 5, but we're just going to focus on X-linked. And X-linked hyper-IgM is caused by a genetic mutation of the CD40LG gene, and it's located on our X chromosome, specifically on the long arm, the X chromosome located at XQ26. So it's about right under this line, right there. And fun fact, according to rarediseases.org, X-linked hyper-IgM is the most common type of hyper-IgM, and it accounts for about 70% of the affected individuals. An X-linked hyper-IgM is a recessive sex-linked disorder, so it affects males, but women can be carriers. And with the other types, so type 2, 3, 4, and 5, they are autosomal recessive, which means they are not located on the sex chromosomes. They're located on other chromosomes that we have. So they're equally distributed between male and female. And with cell communication for hyper-IgM, we have a process called class switching. And on individuals that don't have hyper-IgM, our T cells make a protein called the CD40 ligand, which fits into a receptor on our B cells. And our B cells are they're located in our bone marrow, they're blood cells. And so with normal individuals, this is where the signal transduction pathway comes into play. There's 3 stages: reception, transduction, and response. And in reception, the T cells fit into our B cells like they do our bro shake. And then a signal tells the ligand-gated ion channel, it tells the gate to open so our ions can flow through. And when the ions flow through, then comes transduction, and the B cells receive the signal to start producing new classes of antibodies. And then in the final stage, response, our B cells start producing different classes of antibodies. So instead of producing immunoglobulins M and D, they start producing immunoglobulins A, E, and G. So that is why we have strong immune systems, and we can fight off a lot more bacteria and different kinds of infections than they can. However, with hyper-IgM syndrome patients, they do not produce the CD40 ligand, which means they can't connect to our B cells. The signal does not tell the gate to open, so the ions can't flow through. The B cells don't receive the signal, and they can't start producing different classes of antibodies, which is why they have weak immune systems. So they are prone to opportunistic infections. They are at higher risk of cancers, like cancers that have to deal with the lymphatic system, and they get rare diseases that we normally wouldn't get because with our strong immune systems we can fight those infections off. And there are different ways to diagnose hyper IgM, and patients are usually diagnosed within the first few months or within the first year of life. So we can do a blood test. So just take a quick blood sample. They'll test your levels of immunoglobulin M, immunoglobulin D, and they'll see if you have any of the other types of immunoglobulins. And the second test they can do is a CD40 ligand flow cytometry, and that's where it's a test to show the increased or decreased level expression of the CD40 ligand on our T cells. And then the last test they can do is a CD40L gene sequencing, and they're checking to see for any mutations on our CD40L gene. And with treatment, all the types, X-linked type 2, 3, 4, and 5, they can all be treated through immunoglobulin replacement therapy. So it's an infusion. They start an IV, and they'll just pack these patients full of immunoglobulins, these antibodies, so that will boost their immune system, get them back to their normal levels they should have. And type 2 and 4 can be helped, treated with these infusions alone, but X-linked and type 3 can be cured with a stem cell transplant, allogenic hematopoietic stem cell transplant. So they start the transplant, and the cells that they're adding in become one of the 3 types of blood cells, and these cells start producing healthy cells and get you back to normal levels of antibodies and white blood cells, so then their immune system strengthens up and they can start fighting off these pathogens, opportunistic infections. It gives them a lower risk of certain cancers. And right here is baby Wally. My mom knew about him. She saw him on Facebook. And there's a GoFundMe up if anyone would like to contribute. But baby Wally was born healthy, was growing right, was eating right. And then at about 4 months into his life, he started getting sick, and they took him from doctor to doctor to doctor. And everyone told him, he's got the flu, it's just a viral infection, take some antibiotics, he'll be fine. And then one day he had a 104.4 degree fever. So the doctors ran some tests and found that he had a rare form of pneumonia, pneumocystis. So they raced him to the hospital, Children's Hospital, and there he was diagnosed with hyper IgM, and they said the only way to cure him was to give him a transplant, stem cell transplant. So they entered him in the system, found a donor. The donor hasn't given permission yet, which they have to have, and they said their plan B is to give him umbilical cord blood, because umbilical cord blood is packed full of stem cells, so that is their plan B. But yeah, they'll have to wait until he is healthy enough to receive the treatment. And also, the website I found him on didn't tell me what form of hyper IgM he has, but we can assume that it's either X-linked or type 3 because he is a male, which accounts for most patients with hyper IgM, and because they said he can be cured with a stem cell transplant. And also, the colors, I chose blue and green because the Hyper IgM Foundation, their logo is blue and green.